Hello, everyone. My name is Attallah Dillard, and I am proud to be presenting on behalf of my research team from Charles R. Drew, University of Medicine and Science. Today, I will be presenting on our research poster titled COVID-19 Vaccine Academic Community Teams. For those who may not be aware, Charles R. Drew University of Medicine and Science is located in Willowbrook, Watts, the heart of South LA, and surrounding our university are multiple public housing communities. Our research team sought to address COVID-19 vaccine hesitancy, specifically among African American and Latinx public housing residents through a multi-level community-driven and culturally sensitive intervention. One component of this intervention was to train community health workers as well as graduate health professional students as COVID-19 experts in addressing hesitancy among public housing residents. And our approach to this was providing a multidisciplinary and culturally sensitive training to these individuals to prepare them to be able to address the nuanced nature of vaccine hesitancy among ethnic racial minority groups such as public housing residents. And so the purpose of this pilot project was to evaluate the effectiveness of this multidisciplinary and culturally sensitive COVID-19 vaccine training program. This was a cross-sectional design in which we trained what we called academic community for improving vaccine acceptability and targeted engagement leaders with a multidisciplinary and culturally sensitive approach. This training involved 7 sessions that were self-paced and all virtual, in which participants obtained knowledge from a multitude of disciplines, including infectious disease, nursing, pharmacology, or pharmacists, as well as cultural competent and public health experts. They completed a pre as well as post training questionnaire in which we were able to measure, or which our goal was to measure COVID-19 disease and vaccine knowledge, as well as preparedness to work with public housing residents. Our analyses findings are descriptive as well as findings of our paired sample t-tests to determine differences in our measures. We were able to recruit 114 Activate leaders that consisted of graduate nursing students, physician assistant students, graduate public health students, as well as public housing residents. Compared to only 55% at the baseline or prior to training, 80% of our sample reported having at least adequate knowledge of COVID-19 vaccines following their training sessions. So 55 to 80% was a difference we identified in terms of our participants feeling more knowledgeable about the vaccine. Additionally, compared to only 42% prior to the 7-session training, 67% reported being somewhat prepared to provide COVID-19 education specifically to public housing residents following their trainings. Throughout our analyses, we developed 2 indices from our 9-item survey that allowed us to compare differences in general COVID-19 knowledge as well as preparedness to work with public housing residents from our intervention. As you can see here in our table 1, our t-test findings indicate differences in COVID-19 knowledge before and after our multidisciplinary and culturally sensitive training. The same is said for COVID-19 preparedness. There was a statistically significant difference in our participants' perceptions of feeling prepared to provide COVID-19 education to this unique population before and after their training. And so what our findings suggest is the effectiveness of a multidisciplinary and culturally sensitive educational training for individuals who may be going out into the community and need increased COVID-19 knowledge, specifically to prepare them for mitigating hesitancy among under-resourced populations, such as public housing residents. We believe that there's promise of this form of COVID-19 education training that can be adapted across multiple public health efforts and groups. Additionally, the teams in which will work together for the future that we're trained together will be composed of healthcare professionals and community residents. And so they'll be in a unique position to influence COVID-19 vaccine uptake. Thank you so much for listening to the findings of our study. Have a great day.